So the first thing in our keep it simple, silly rule is to determine the sequences that we have on our MRI. Now there's different sequences at every hospital and with different brands of scanners. However, there's a core set that you're going to see, in particular in neonates. And those sequences are a T1, a T2, a diffusion weighted image, or DWI, an ADC map, or absolute diffusion coefficient map. And then the last one is a susceptibility weighted image. So that's the first thing, is to understand the sequences that you're getting on your particular MRI. Now, our second checklist is to identify the sequence. And so how are we going to do that? Well, in T1, water is dark, fat is bright. So what we do is we look for the lateral ventricles and we look at the cerebral spinal fluid. If the cerebral spinal fluid is dark, we know that's a T1 weighted image. Now in T2, it's actually the opposite of the T1s. Water is bright and fat is dark. On the diffusion weighted images, after injury, there's a problem with water flux. And this really represents an early sign of injury. And these appear as bright areas on the MRI. The next sequence is the absolute diffusion coefficient map, and the areas of brightness on the diffusion weighted images should match dark areas on the ADC map, and that really confirms areas of injury. The susceptibility weighted images look for blood,